All right. John. Charlie's so serious.
No, that's just his face.
All right, so we're gonna get started. My presentation is gonna be on exercise in place of medications. It's actually been shown that exercise can be just as effective as some medications out there. Obviously, taking a lot of medications isn't always the best option. It can cause other side effects, and it can cause you to have other health problems and take more medications because of those other side effects. And then being an exercise physiology major, part of my degree is actually prescribing exercise programs to people, so getting that knowledge out there is really helpful, and hopefully some of it can be applied throughout this. And then we're going to talk about these main points tonight. Exercise recommendations come from the ACSM. Their 2011 guidelines. They're pretty accurate and they're still applied today. Then we're going to do exercise used for prevention, and then talk about exercise and how it's used in place of medications, and then why we should be prescribing it more. All right, so first off, the recommendations start with cardiorespiratory exercise, which is going to focus on your heart and your lungs and your circulatory system, and it's going to make sure that it's working efficiently. You should do about 150 minutes per week of this form of exercise. You can obtain that by doing 30 to 60 minutes of moderate exercise 5 days per week, or 20 to 60 minutes of vigorous exercise 3 days per week. Resistance training is next up, and that's going to focus on major muscle groups, and you should work those muscle groups 2 to 3 days per week. If you want to build strength, you're going to do 8 to 10 repetitions, and if you want to work on endurance, you're going to do 12 to 15 repetitions. And then there's flexibility, which is going to focus on your range of motion. This is also performed 2 to 3 days per week, and you will focus on static stretching, dynamic stretching, ballistic stretching, and PNF sometimes if necessary. The neuromotor exercises are going to focus on your motor skills, and these should also be performed 2 to 3 days per week, and you're going to focus on balance, agility, coordination. And then we're going to talk about how it's used for prevention. Starting on my words tonight. So that one's going to talk about how regular exercise can prevent cardiovascular disease, stroke, hypertension, type 2 diabetes. It also has a good impact on obesity, anxiety, and depression. There is a study done by a professor at Harvard Medical School, and they actually found that in 2014, if you do 2.5 hours of brisk walking just per week, you're going to reduce your chances of heart disease by 14%. So if you think about it in terms of if you did more exercise than that, or even if you walked 5 days per week, you have an even greater chance of reducing things like that. This picture over here is also showing a scan of a brain. With exercise, you're going to activate more parts of your brain and keep it up to speed. And then without exercise, you can obviously see that parts are not being engaged. So that can help with Alzheimer's and dementia and increase your memory. And then replacing medications with exercise. So with that, Dr. Ching actually in 2013 said that everybody benefits from exercise at all ages, and even a person with chronic disease already can still benefit from exercise. So even if you have had a heart attack, if you exercise with aerobic exercise, you're going to have a 20% less chance of getting more severe symptoms for your heart, so congestive heart failure and CAD and things like that. Exercise can help you manage your symptoms. I have a few examples of that with a study done on blood sugar. This study was done by Dr. Luc von Loon in 2014. They actually have a Congress that meets every year and talks about the effects of exercise for medicine. And they found that if you do an endurance or a resistance training program session Just one session of that can lower your blood sugar by 1/3, and it can last for up to 24 hours. So people with type 2 diabetes typically have higher blood glucose. So if you can maintain that and reduce it, then they're probably not going to need as many medications, oral or insulin injections, and you can control their insulin release better. Also, there was a study done on depression by a professor in Sydney, Australia, and she found that a higher intensity resistance training program can reduce the amount of depression. So if you have a mild case of depression, exercise can probably actually prevent you from being on any medications at all. And why doctors should be prescribing this more. Before medications, it's actually going to be more cost effective. Not every kind of exercise requires a gym membership. So you can get out there, you can do at-home programs, you can get out in nature and just take a hike. So it's definitely more cost effective because a lot of medications can be very costly to you. And it's a good start before you have to be prescribed medications. Again, you're going to avoid those extra side effects that could cause you to be put on more medications, which you don't want. As I said before, more side effects can cause more medications. And then overall, you're going to improve your quality of life. Less medications, having a healthier lifestyle will just make it easier living for you. So in conclusion, the ACSM recommendations are a great baseline to go off of. Usually you're going to have a health risk assessment done for you just to see where you fall in those recommendations. Obviously, if you've had a chronic disease or anything like that, or a heart attack, you're going to have to adjust those appropriately until you're ready to be up to speed. It's great for preventing chronic disease, as I said before. And then it's awesome for replacement of medications. As I showed you, there are studies that show that it's just as effective and you can avoid other symptoms and lower your risk of other diseases. And there's several reasons for exercise prescription. The sooner you start, the better off you are. And a little exercise is better than no exercise at all. So, yeah. Do you guys have any questions? No? Very good. And those are my references. All right.
Thanks, guys.